Now, what about the ascending colon? Yes, we already explained the cecum, and let us ascend up through the large intestine, through the colon. So you approach now the ascending colon. So first of all, it's located in the, if you divide the abdomen into four parts, you will see that it's located in the right lower quadrant. This is number one. And you know, it's retroperitoneal structure. What does it mean? It means it lies behind the peritoneum. That means the peritoneum just covers, as you see here in this figure, it covers just the anterior and the lateral side of the ascending colon, and similarly the descending colon. Back to the ascending colon. Look at the ascending colon. Look at the peritoneum that covers the lateral and just anterior surface of the ascending colon. That means no peritoneum behind it. That means it's retroperitoneal structure. So this is just to show you that it's located in the, mainly in the right iliac, in the right lower quadrant. And here is like, if you divide it into 9 regions, it's in the right flank. Anyway, what's the relation of the ascending colon? Just keep in mind that it's a mirror of the or the descending colon. It's a mirror of the relation of the descending colon. It's a mirror of ascending and cecum. But anyway, back to the ascending colon and the anterior and posterior relation of it. Anteriorly, you know, this is again the ascending colon. So anteriorly, it's related to anterior abdominal wall, and you see here's the greater omentum that, you know, descends like apron, and of course coils of small intestine. That's very simple. Also, similarly, these structures also related to the descending colon. Back to the ascending. Again, this is the ascending colon that you see here. Posteriorly, if you start from here, it's related partially to the iliacus muscle, to the iliac crest, to the quadratus lumborum. This is a muscle, quadrangular in shape. We call it quadratus lumborum. And you see the shadow of the right kidney, so it's related to the lower pool of the right kidney, plus two nerves, ilio, which is a branch from lumbar plexus, iliohypogastric, and ilioinguinal nerves. So these structures related to the posteriorly to the ascending colon. So what's the blood supply of the ascending colon? This is the ascending colon. You remember that maybe that the ascending colon it originates or developed from the midgut. That means it's supplied from branch from superior mesenteric artery. Which branch? This is the superior mesenteric artery that gives, if you remember, the ileocolic branch, and also it gives the right colic branch. Now forget the middle one. It's not the time to talk about the middle colic. Just you have ileocolic and you have right colic. Ileocolic and right colic, those branch supply the ascending colon, and similarly the venous drainage will be to the veins corresponding to those artery, ultimately again to the superior mesenteric vein. Very simple. So ileocolic and right colic. Lymphatic drainage, as I am saying always, that the lymphatic vessels follow the deep arteries. That means there are lymphatic vessels drain to lymphatic nodes lying along the colic arteries, and I mean the ileocolic and right colic. So there are lymph nodes there. Ultimately, they will drain again to the source, close to the lymph nodes that close to the source of the arterial supply, which is, you know, that this is the superior mesenteric artery, and here is you have the lymph nodes around the superior mesenteric artery. We call them superior mesenteric node. Very simple to remember. Nerve supply comes from the nerve plexus, the sympathetic nerve plexus, superior, around the superior mesenteric. We call superior mesenteric the plexus, and the parasympathetic, of course, comes from the vagus nerves. Okay, I will skip now the transverse colon because it's better to study directly the descending colon because it's a mirror of the cecum and ascending. So this is the shadow you see here of descending colon. The descending colon, as I mentioned, it's equal to the cecum and ascending colon. So the descending colon is longer than the ascending colon because again it's equal to the cecum and ascending. And also the relation of the descending colon, it's similar to the relation of the cecum plus the ascending colon because it's equal to both. Anyway, that means because it's longer, it's located not just in the uh, um, left lower quadrant, no, but also it's located in the upper left lower quadrant. That means it's on the left side in the upper and lower quadrants. So it extends from the what we call it left colic flexure here. There is a flexure, we'll talk about it. There is right colic flexure and there is left colic flexure. So the descending colon descends from the left colic flexure all the way until you reach the pelvic prim. Here is the entrance from the false pelvis to true pelvis. Similarly, as I mentioned, it's a retroperitoneal structure. That means it just covers from anterior and lateral. That means the peritoneum covers the lateral and anterior surface of this part of the colon. Okay, now again, as I mentioned earlier, the relation of the descending colon would be similar to the relation of the cecum plus ascending colon. So this is the descending colon, my friends. That means anteriorly, which is similar to the ascending, it's related, of course, to anterior abdominal wall and greater omentum and coils of intestine, which is similar to ascending. Back to descending. As I mentioned, the posterior relation would be similar to the cecum and ascending. So it would be the iliacus and the left psoas muscle, quadratus lumborum, iliac crest, and you see here the also iliohypogastric and ilioinguinal nerve, and also back here inferiorly you remember the cecum that's related to the lateral cutaneous nerve of thigh and femoral nerve. Yes, also the back again, yes, we mentioned that's related to iliacus and psoas, and also the lateral, of course this is the left lateral cutaneous nerve of thigh and the left femoral nerve. Similarly, if you know the structures that related to cecum and ascending, you know the structures related to descending. Okay, so let us summarize the structures. Let me change the color. Summarize the structure related to the descending colon. So you have iliacus, pass on it the lateral cutaneous nerve of thigh. You have the iliopsoas. You have the psoas major, of course, the left one. So you know we have the iliopsoas tendon here. Anyway, between these two muscles, you have the femoral nerve, you have the iliac crest, quadratus lumborum, you have the iliohypogastric nerve, ilioinguinal nerve, and you have here the lower pool of the left kidney here. As you see the left kidney. So these structures related, of course, to the descending colon. The blood supply, if you remember the ascending, the blood supply to the ascending was from the ileocolic and right colic. They are a branch from the superior mesenteric artery, but the descending colon, my friends, the blood supply comes because the descending colon is part from, or it developed from the hindgut. That means the blood supply is from inferior mesenteric artery, not superior, from inferior. This is the superior and this is the inferior mesenteric artery that gives a branch. One of them is the not right colic, no, it's left colic artery that gives like many branch to the and supply the descending colon. Of course, it makes like here anastomosis as a marginal artery with the middle colic. Anyway, so the blood supply of descending, because descending colon part from hind gut, that means the blood supply from inferior mesenteric artery through a left colic artery and part from sigmoid branch, because this is the left colic and sigmoid branch. So the sigmoid branch also participates in the supply of the descending colon. Ultimately, they are from the inferior mesenteric artery. So back to the transverse colon. So because it's better to study the, let me change the color, study the ascending colon, cecum and ascending colon, then shift to the descending colon and cover the blood supply of both of them. And so the ascending, as I mentioned, ascending colon, the blood supply comes from ileocolic and right colic, while from superior mesenteric, while the descending colon, the blood supply comes from the inferior mesenteric through the left colic and sigmoidal. Anyway, now let us shift to the transverse colon. This is the transverse colon, which is like hooked up or like pulled or reflected up. Anyway, you have to know that the transverse colon is the longest part of the colon, which is about 50 centimeters, and it's the most mobile part of large intestine that usually occupied the umbilical region. So the longest and the most mobile part of large intestine. And you see here, it's because it's why it's mobile, because it's connected, because it has its own mesentery that connected it to the posterior abdominal wall. What's the name of the mesentery of transverse colon? We call it transverse mesocolon, right? Transverse mesocolon. So this is a sagittal section. You can see here is the stomach and here is the transverse colon. And you see the transverse colon, it's intraperitoneal structure and fixed to the posterior abdominal wall by a mesentery called transverse mesocolon. Look at it here, like split up and below the pancreas. So it originates from, let us say, or the root of transverse mesocolon ultimately lies along the inferior border of the pancreas. This is the pancreas and the inferior border of the pancreas. So it comes ultimately from here. Okay, that's excellent. So back again, this is the transverse. This is the transverse colon, and it crosses. Look, from the right corner to the left corner. That means has two corners. This one, which is again in the right, we call it right colic flexure. This is the right colic flexure, this angle, and this is the left colic flexure. The right colic flexure is lower than the left. The left is more acute, like sharp. The angle is sharp than the compared to the right. So the right colic flexure, we call it hepatic flexure because it's against the liver, right? While the left colic flexure called splenic. So if you have the liver here, you have spleen here because it creates a kind of impression on the hilum of the what do we call it, the spleen. So this is the splenic flexure. Sometimes, usually, they prefer to use hepatic flexure and splenic flexure. Anyway, so the right, let me erase it. Okay, so back again, the right colic flexure or the hepatic flexure lies against the 9th and 10th ribs, which is like overlapped, as I mentioned, by the inferior part of the liver, while the left colic flexure, we call it again the splenic flexure, is usually at the first, it's if you draw it like this, it's higher than the right? One more acute and less mobile because it's fixed. So you see the spleen, so it's fixed to the spleen, it's fixed to the pancreas, and it's fixed here, most importantly, to the diaphragm. You know, here we have the diaphragm, right? There is important ligament here. We call it phrenico colic ligament. That means phrenico, that means the diaphragm, related to the diaphragm. This one, the ligament that we call it phrenico-colic ligament, I will show you where is that. Again, this is the right colic flexure, left colic flexure, that's connected posteriorly, you see here, and to the spleen here, and to the spleen here, and to the diaphragm that's located here. And look at this, the phrenico-colic ligament. This is the, again, left colic flexure related to the hilum of the spleen, and also if you have the diaphragm here, it's connected by this ligament, phrenico colic ligament. That's why in the splenomegaly, when the spleen like enlarged for a reason or another in size, so because of the presence of this ligament, the phrenico-colic ligament, then you find the inferior pole of the spleen like moved down there in that direction, because this phrenico-colic ligament prevents it from protruding in this anteriorly and in this direction, right? So it moved, the inferior pole moved in that direction, right? Okay. So the relation of transverse colon is very simple: the anterior abdominal wall and the greater omentum. And posteriorly, let us look at it here. This is the right colic flexure, and this is the left colic flexure, and this is the transverse colon. We cut it here to show what's going on behind it. So you have the second part of the duodenum, and of course you have the head of pancreas, and sometimes the third part from the third part, and you have the coils of small intestine, jejunum, and ileum. So what I want to say that because of the posterior relation, it's variable. Why it's variable? Because sometimes, because you know it's freely mobile, that means the transverse colon is variable in position, right? Usually hanging to the level of umbilicus, L3, L4, and in thin and tall people, the transverse colon may extend down to the pelvis, right? That's why the posterior relation is like variable. Okay, now to the blood supply. And again, I like always to remind you with the blood supply of ascending and descending before jumping to the transverse. You know, this is the superior mesenteric artery, and this is the inferior. You know, superior mesenteric artery gives the ileocolic and right colic. Those supply the ascending colon and cecum. And here is the inferior mesenteric that gives the, not right colic, no, it gives left colic and sigmoid arteries. They supply the descending colon. Now jump now to the transverse colon, and maybe from embryology, you know that the proximal 2/3 of the transverse colon comes from or developed from the mid gut, while the distal 1/3 of transverse colon developed from hind gut. That means the blood supply of mid gut, as you know, comes from superior mesenteric, while the blood supply to the hind gut, or the structure developed from hind gut, comes from inferior mesenteric, not superior mesenteric, comes from inferior mesenteric. That means the proximal 2/3 of transverse colon, or the right 2/3, comes, the blood supply comes from the superior mesenteric artery, exactly from the middle colic artery. Middle colic artery, that of course anastomoses with the right colic here at the marginal, forming margin artery. Anyway, middle colic, remember, middle, the transverse colon in the middle, that means middle colic artery, right? Also, what about the left one third or the distal one third of transverse colon? Yes, because it parts from the develop from behind gut. That means it's a blood supply from inferior mesenteric, exactly here from the left. You remember the left colic that gives the branch to the descending, and also it also supplies the distal one third of transverse colon, right? Okay, and also here's a marginal artery between those at the corners, right? So the veins correspond to the arteries and drain into, arteries or the parts supplied by inferior mesenteric. That means the blood supply will be back to inferior mesenteric vein. Bars from transverse colon that's supplied by superior mesenteric branch, superior mesenteric artery or the branch of the superior mesenteric. That means the blood supply will be drained into similarly superior mesenteric vein. Superior, inferior with inferior, and also, as I am say it again and again, the lymphatic drainage follow the deep arteries. That means the proximal two-third of transverse colon will be drained into these. You see these lymph nodes that follow the branch of superior to the branch of superior mesenteric, which is here. In this case, this is the middle colic artery, right? And these lymph nodes, we call them middle colic lymph nodes, and they of course drain into. This is the superior mesenteric artery. These nodes around superior mesenteric artery, we call them superior mesenteric nodes. And what about the distal one third? Similarly, you have also in the distal one third, these nodes drain that they exist along the left colic. They ultimately drain into lymph nodes around the inferior mesenteric artery, and these nodes called inferior mesenteric nodes. Very simple. Follow the arteries. Lymphatic drainage follow deep arteries. Okay, that was about the ascending, descending, and transverse colon. Now we finished the ascending colon, transverse colon, descending colon. Now it's the time to join the sigmoid colon. Look at this curved S-shape part of the colon that's known as sigmoid colon. Sigmoid colon is similar to transverse colon, that it has its own mesentery, while the mesentery of transverse colon was transverse mesocolon. The mesentery of the sigmoid colon called sigmoid mesocolon. So that means it's a mobile structure similar to the transverse colon. That means it's an, I would say, intraperitoneal structure. So this is the final segment of the colon, and it just located above the pelvic inlet, and it extends from the beginning of the pelvic inlet up to the we call it S3, the vertebra of or sacral vertebra number 3, sacral vertebra number 3. So this is the end of sigmoid colon and the beginning of the rectum, and this is we call it rectosigmoid junction. That means extended from the pelvic inlet to the S3 vertebra, sacral vertebra number 3. So it's quite mobile, S in shape, except of course because here is started it's a continuation of the descending colon, and that means, and the descending colon is retroperitoneal structure. That means it's fixed. That means this part of sigmoid colon is not that much, it doesn't has that much of mobility. Similarly, it's fixed to the rectum here, so this part is not that much mobile. So just mainly the middle part is the quite mobile part. So that was about the we described just the sigmoid location, start and end, and its relation to peritoneum. Now, if we want to dig deep and see what's behind and lateral to the sigmoid, indeed, most importantly here, the posterior relation of the sigmoid, you can see you have here is the left common iliac artery that divided into internal iliac and external iliac. Look at the left internal and external iliac branch. They are located behind it. That means what's behind the sigmoid? The branch of the common iliac. That means you have the internal and external iliac arteries. Of course, I'm talking about the left side, right? Because the sigmoid on the left side. What else? If you know that the common iliac divided into internal and external, you know this bifurcation side. That means you know that the ureter, which is very important, crosses anterior to this bifurcation. That means what's behind the sigmoid also? You have the ureter. Okay, and also you know that the ureter is crossed by gonadal vessels. That means also you have gonadal vessels, and also you have the piriformis muscle here, and you have the sacral plexus as well. So what's posterior to the sigmoid? The internal iliac, the left internal iliac and external iliac. At the bifurcation here, you have also the ureter crossed also by the gonadal vessels, and you have the psoas muscle and sacral parts from the sacral plexus. Indeed, the obturator nerve, because of course the sigmoid colon has this part, I would say, has two parts. This is descending part and horizontal horizontal part, descending part. So the laterally it's related to the left external iliac artery, obturator nerve here, and in female you have the ovary, and in the male you have the vas deferens and the lateral pelvic wall as well, right? But anteriorly, again, this is the sigmoid, and anteriorly in the male you have the urinary bladder. But in female, you know, the female has also uterus located here. So in male, it's related to the posterior surface just of the urinary bladder, but in female it's related to the posterior surface of the uterus, right? Okay, so that was the relation of sigmoid. But we mentioned that the sigmoid is connected to the posterior abdominal wall by a mesentery. We call it the sigmoid mesocolon. So you know that sigmoid mesocolon comes from the posterior abdominal wall, so it has a root. This is the root of it. It's like V, inverted V shape. You know, this is the V shape, but indeed the sigmoid mesocolon is inverted V shape, that it has apex here, and it has right limb and left limb. This is the right side, huh? And this is the left side. Anyway, so we talked about the sigmoid, the mesentery or the root of the sigmoid mesocolon. Let us erase these things. And again, you can see here is again the inverted V shape of the sigmoid mesocolon. So the apex, where is located? Look at the shadow here. This is the external iliac artery, left external iliac artery. That means here is the internal one. This is the external iliac. This is the internal iliac. This is the bifurcation. That means this is the common iliac that divided into internal and external iliac. This is the bifurcation. That means the apex of the V, the apex of the sigmoid mesocolon, located near the bifurcation or division of left common iliac into internal and external at this bifurcation, right? In which also, look at the shadow here. You have the shadow of the ureter that crosses also here. So again, the apex of the V located near the bifurcation of left common iliac artery, internal and external, that crossed by ureter, as I mentioned. Let us erase it again, and let me show you here maybe the next figure. Here is the apex. This is the sigmoid mesocolon, and this is the apex of it. This is the right limb, this is the left limb. So this is the left common iliac artery that divided into external and internal, and that this bifurcation of the common iliac crossed by the left ureter. So this is the location of the apex. So because you have to know what's going on in each part of the mesentery. Now, what about the left limb? This left limb that goes in this direction close to the, let us say, medial border of the psoas major muscle, right? And what about the right limb? The right limb indeed continues until the end of sigmoid. That means until the level of, S3, sacral vertebra number 3. Now, you have to know, look at the sigmoid arteries, which is a branch from inferior mesenteric. These sigmoid arteries passes through this double layer of peritoneum, through this mesocolon, sigmoid mesocolon. So you have the sigmoid arteries, and also you see this branch, which is the superior rectal vessel to the rectum. Superior rectal vessels passes here in the border, left border here, in the right limb here. Also, you have nerves and lymphatics, as you know. Here's again, this is the sigmoid mesocolon, in which the it's like this shape, right, in which the apex near the bifurcation of the common iliac and crossed by ureter. And here is the, look at the superior rectal artery that passes here. Let me erase it. Okay, so the superior rectal artery passes in this right limb here, right inside this peritoneum, inside the sigmoid mesocolon. And here is the sigmoid arteries also, and lymphatics and nerves. Okay, so, as I mentioned, the blood supply will be through the sigmoid arteries branch from the inferior mesenteric artery.